Hello friends. Now let us look at our next question in our series MCQ for you. I am Dr. Amit Desai. I am a surgeon and I take lectures for FMGE and NEET PG. All right. So here we are. A patient presents with pain and tenderness in the left iliac fossa. Now USG shows a 3 centimeter calculus, 3 centimeter calculus in the renal pelvis. There is no hydronephrosis. What is the most appropriate management? Okay, what is the most appropriate management? Now, let us look at this, all right? So, let us look at this. Let us look at the renal calculus. When we talk about renal calculus, we have to look at two things. Whether we are dealing with a Staghorn calculus or whether we are dealing with a non-Staghorn calculus. Now, our calculus over here is a non-Staghorn calculus, all right? How do we know that? Because there is no hydronephrosis over here, okay? They are saying there is no hydronephrosis. So, there's no question of finding out whether the kidney is functioning or not. We are dealing here with a non-Staghorn calculus, most probably. Now, once we are dealing with a non-Staghorn calculus, we will look at the size. Okay, whether it is less than 2.5 centimeters or whether it is more than 2.5 centimeters. This is our magic figure, 2.5 centimeters. So if it is less than 2.5 centimeters, we will advise an ESWL. But if it is more than 2.5 centimeters, we will advise PCNL. And if the ESWL fails, then we will advise PCNL. So what is the full form of ESWL? ESWL stands for extracorporeal shock wave lithotripsy, where we are using waves generated to break the sound waves that are generated to break the calculus. What is the full form of PCNL? PCNL stands for percutaneous nephrolithotomy. Nephrolithotomy means removal of a stone from the kidney. And how do we remove it? Percutaneously, okay, by minimal invasive technique. All right, so this is what we are going to do. Okay, so our calculus is more than 2.5 centimeters, that is 3 centimeters. So here we are going to do a PCNL for this particular patient. All right, PCNL we will do. So this was about this particular question. Now, if you have liked this video, please subscribe to our channel ADSL Academics. Please press the like button and please also press the bell icon so that you will get all our subsequent recordings. Okay. Thank you very much.